Good day to everybody joining us on this community spotlight. Thanks for joining us. Today we have a special treat. We have our very own Rejuve.AI medical advisor, John. Hey, John, thanks for coming on board today.
Thank you for the invitation, Stuart, and very, very grateful for your time today.
Cool. Well, I know your time is precious, and we normally just try to keep it within 15 minutes. So I won't beat around the bush, and I'll dive straight on in there and ask if you could maybe just introduce yourself in the sense of a bit about your background and how you came to pursue a career in the medical field. Simply as that.
Yeah, sure. Thank you, Stuart. So, my medical training was done in the UK from Liverpool University. I graduated in the year 2000, and my main interest at university was actually anatomy and anatomy dissection, and that was really what drove me into the surgical specialty. And within that, I found a big interest in orthopaedics, mainly through the management of sports injuries, being very, very sporty myself. So it was a combination of the anatomy and the interest in sports that really got me into orthopaedics in the first place. And I went through a long period of surgical training in and around Yorkshire, and then took a post as a consultant in 2013, and with a subspecialty of knee surgery, which was predominantly the treatment of young adults, so primarily sports injuries, but also young adults with osteoarthritis of the knee, looking at partial knee replacement and joint preservation. So that's my background from a medical and a surgical standpoint.
Oh, fascinating. I myself, as a former sports person, had a bit of knee injury, so really appreciate that your expertise has been used in that way, because it is quite a tough one if you get an injury, and nice to have someone who's skillful enough who can help you back on the field, so to speak. Anyhow, now you've ascended to the lofty heights of being medical advisor with Rejuve.AI with ourselves. So how did you become involved? What inspires you in this obviously with us, but also the wider field in terms of the AI and medicine? What's your views on that, John?
Sure. Well, around the time of the pandemic, we actually stopped our elective surgery for almost 2 years, because obviously we didn't have any theatre nursing staff or anaesthetists to manage the operating list. So we were simply doing trauma. So a lot of my time was actually freed up because of no elective practice, and I found myself working a lot more in the corporate sector, particularly around product implant and design for orthopaedic surgery. And with this, I then got involved with a company based in the Netherlands called NLC, who are essentially medical technology venture builders. They look at new technologies and support them. And this, I became an advisor, a board advisor for that company, and with that, my eyes were opened into the world of digital transformation, artificial intelligence applications, and such ventures of longevity. So I really had my eyes opened then. That was around 2 years ago now. Subsequently, on the back of that, I became a chief medical officer for a health tech company using artificial intelligence to provide precision nutrition programs for patients with osteoarthritis. So really drilling down into things like biomarkers and patient profiles to provide anti-inflammatory diets and nutrition for those patients, so to manage them without surgery, as it were. So that was one sort of lead into the area. And subsequently, I've been working for a company who actually work largely in the aviation and financial sector in data engineering and artificial intelligence. But we've now worked our way into the healthcare space, mainly in diagnostics, care delivery platforms, and biotechnology. And obviously, you can see from that there's an awful lot of crossover with my interest in Rejuve. But really what stimulated me to get involved was reading an excellent book that I could recommend to all you members out there called Life Force, which is, I'm sure you've read this, Stuart, by Tony Robbins, which is an excellent book looking at basically precision medicine and quality of life and how and what the outlook of the healthcare and the medical space will be over the next 5 to 10 years. And then I've been following Rejuve for a while on LinkedIn and YouTube, and really this is an extremely exciting space. And it was the concept of collecting big data from the population's wearable devices. I myself am a big Strava freak in terms of collecting data, analysing my statistics on Strava and big data, and whether it's a Fitbit, a Garmin, an Apple Watch, and using this data for the benefit of the healthcare space and ultimately patient care. And that's really what's driven me into this area.
Right. Okay. So is there any particular project or part of what Rejuve's doing that you think you're particularly excited by? Is it that the integration with the wearables, or is it more or you're looking at the longer term research prospects as part of our network? What is there anything that stands out for you, shall I say?
Yeah, I think good question. I think both really. I think one of the problems with data collection in the healthcare service is that it's hard to sometimes access that data. And I think by incentivizing people in the community, hospitals, clinicians indeed, to collect this data and make it worthwhile, I think is a very good prospect really. And I think that is ultimately where Rejuve are going to do well, because it's the incentivization with the token-based systems to make sure that we collect and optimize this data efficiently. And as you say, looking forward, I think the work in and around biotechnology and drug discovery, and with that disease identification and prevention is really where it's at. And I think that for me is really it's how we're going to process this data and how we're going to use this data ultimately to improve longevity. So it's really the bigger picture for me and the future that interests me the most.
Okay. Actually, talking about obviously processing data, and we're obviously looking at it in an AI context. I know that the British government, the new government, is looking seriously at publishing a new AI bill shortly. Previous government was a bit more light touch. What's your thoughts in terms of what the pros and cons in terms of medical research? What's your thoughts on that? Because obviously that's quite an important issue, really.
It is, and I mean it's extremely topical at the moment, isn't it? And I mean the NHS England, the Department of Health, have actually massively funded this space over the last year or two, and that tells us everything we need to know really about artificial intelligence. There's obviously a lot that we need to learn and understand to make this safe. And it's a bit like a self-driving car. If you ask a room of people who would trust a self-driving car, you may only get certain hands going up. So we've still got a lot to learn in terms of the safety aspects of the implementation of this. But already over the last 6 to 12 months, I've seen enormous developments in the diagnostic space in terms of musculoskeletal reporting of MRI scans, CT scans, and X-rays, and then making sure that these AI reports are validated properly by trained clinicians like consultant radiologists, for example. That's just one example of the way AI can really benefit patients and reduce waiting lists. But yes, in terms of the safety aspects as well, we need to consider all the usual regulatory concerns around healthcare data, GDPR, HIPAA in the States, and it's piecing all of these things together and implementing these projects in the sort of safest, optimal way. Really, I hope that answers the question.
Yeah, no, it's a really good answer. I mean, I guess taking it out of the policy, bringing it, into sort of the more the public realm. What are the sort of? I mean, I guess part of the problem is that politicians are people as well, and they have misconceptions. But what in work you've done and working for Rejuve.AI, what are some of the? Would you say some of the common misconceptions people have about longevity? And whether it might be just family and friends when you're talking to them about it, it'd be interesting. And how do you kind of explain to them in a way that isn't too techie or what have you?
Try and explain things in simple terms, really, because longevity encapsulates many different aspects of healthcare. But I see it really as early disease detection in the first instance. So using AI or other facilities to really drill down and make sure we pick diseases up early. Disease prevention comes along with that. And then we talk a lot about personalized care, and really what we mean by that is a tailored approach to healthcare treatment, really. So what one drug may work for a certain patient, but not for another. If you talk about thromboprophylaxis, the DVT, and embolism, it may be that a certain patient is resistant to that type of blood thinner. So it's really working out using patient specific biomarkers and genetic profiles as to really what to prescribe or treat those patients with. So it's all longevity as a whole is what I would describe as an umbrella term, which encompasses many different aspects of that patient's journey. But ultimately, what we're trying to do is improve patient outcome, quality of life, and life expectancy ultimately, which is what we all want.
Right, I get it. So in that way, longevity isn't something new. It's part of the evolution of healthcare, as such. So yeah, I get what you're saying. I guess in terms of, we've talked about longevity, but there's some interesting things, exciting things already happening in the wider sense of AI applied to medicine. What for you really stands out in the last year that you've just thought, wow, this really shows what the application of AI can do in the field of medicine and health and longevity?
Yeah, sure. Yeah, I mean, we've talked already about the diagnostic space in radiology. That's the a huge area. In fact, around 75% of patient data that is held is actually held within imaging. So that's a huge sector. The pandemic also really changed the way that we all manage things in terms of the way that we work, and healthcare was no different. So AI applications to allow patients to remain at home in the community without attending hospital, and reducing the traffic and the footfall through our healthcare providers, be that a GP practice or a hospital, was really important. And we've seen some fantastic developments in terms of post-operative rehabilitation, for example, with physiotherapy. The NHS have just signed an excellent contract with a new AI company in that space to basically manage those post-operative patients at home. So they don't have to attend the hospital for physio sessions, and that's another example.
Right.
Within hospitals, we can now identify using AI specific risk factors for patients when they attend the accident in an emergency department, to specifically look out for certain clinical parameters which may dictate how long the patient is in hospital for. And that can be proved very cost effective, because it can reduce the length of stay for patients, and also help with the early discharge planning. And then at the back end of this pathway, we've already touched on what I think is the future in terms of drug discovery and biotechnology. And it's only by providing the big life science and pharma companies with this huge population data that we can really drill down and improve that aspect of healthcare in terms of the pharmacology.
Right. So it's broad ranging, its impact. That's one way of simplifying that, but that's impressive. Thanks, John. Well, our 15 minutes is pretty much up. Is there anything that maybe I've missed or I should have asked that you'd like to say in conclusion? Yeah, it's worth me asking.
No, I just think you asked previously about what is longevity, and people say, is this a disease process? No, it's all what you were right to say. It's always been there, and it's a natural aging process. But the reason why I believe it's now in the public domain is that we now have the tools to really impact longevity, and that's really different. It's having the artificial intelligence, the machine learning, and the platforms and models available to really influence this space. So it's something that's always been there, but it's now something that we can really have a big impact on, particularly over the next 5 to 10 years. And with the launch of the Rejuve app over the next over this summer, I think it's very exciting times ahead. So watch this space.
Nice one. Thank you very much, John. Appreciate it. Thanks for coming on to the Rejuve.AI community spotlight.